Good evening. I'm Maisha Brody with HealthWise. A look at how you can achieve and maintain good health. Brought to you by Value Drug Pharmacy, Your Health Matters, and Hermosa Health Center, your place for modern health care. 1A Pineapple Place, Ocho Rios. Call us at 974-3370. If you are losing weight without trying, have an irregular heartbeat, increased hunger, and an enlarged thyroid gland, you may have hyperthyroidism. Hyperthyroidism happens when the thyroid gland makes too much thyroid hormone. This condition, which speeds up the body's metabolism, is also called overactive thyroid. In this week's edition, General Practitioner Dr. Adrian Kaur tells us more about hyperthyroidism. But first, he explains what the thyroid is.
So the thyroid gland is this gland that's in front of the windpipe, right at the base, at the front part of the neck. There is a piece of the organ to the right. There's a piece of the organ to the left. They're joined together by what we call the thyroid isthmus. All of that together is a thyroid gland. And if you think about the gland and you want to think about its function, it's this gland that basically keeps the metabolism and the metabolic activities of the body in check. So, for example, it makes sure that the heart is beating how it is supposed to beat. It regulates your weight. It keeps things like your body temperature in check, right? And it actually affects muscle function as well.
Dr. Kaur says hyperthyroidism is an overfunctioning thyroid.
If it is that you have any anomaly in how the thyroid gland functions, then we now start talking about things like hyperthyroidism. And remember, the thyroid does all of these functions through a hormone it secretes by the name of thyroxine. So normal levels keep everything in check. But then when now the gland, for whatever reason, hyperfunctions and secretes far more thyroxine hormone than it is supposed to, then it hyperfunctions, and that phenomenon is called hyperthyroidism, right? So hyperthyroidism is basically hyperfunctioning of the thyroid gland.
He notes that the symptoms of hyperthyroidism include a racing heart, weight loss, and heat intolerance.
So you're in a room, it's air conditioned, or if you're somewhere cool and you complain of being hot when everybody else is cool and they are feeling normal, right? In addition to heat intolerance, you lose weight unintentionally. So the thyroid function upregulates and your metabolism increases and you start shedding a lot of weight. Diarrhea, hyperdefecation, persons complain of having these bouts of loose stools. Heart racing, we made mention that one of the function of the thyroid is to regulate normal heartbeats. Overfunctioning manifests as heart racing, pounding in the chest. Sometimes patients complain of fine tremors. Patients complain of being anxious, and the reason could possibly be hyperfunctioning of the thyroid. It may also manifest as muscle weakness. Other things, depending on how bad it is, they may start becoming psychotic. So hyperfunctioning of the thyroid, that is hyperthyroidism, could manifest in various ways.
Dr. Kaur explains that hyperthyroidism can be caused by inflammation of the thyroid gland and Graves' disease, which is an immune system disorder that results in the overproduction of thyroid hormones.
The most common cause of hyperthyroidism is Graves' disease, but there are other causes like what we call toxic multinodular goiter, toxic adenoma. Toxic multinodular goiter is basically where you have sections of the thyroid, they're very nodular, and they just for no reason just hyper function and secrete a lot of thyroxine in the blood. But the goiter, which is the mass in the neck, has a lot of nodules. That is one of the distinguishing features. And then you have toxic adenoma, where one single solitary mass on the thyroid is actually doing the same thing, hyperfunctioning and secreting a lot of thyroxine, causing symptoms of hyperthyroidism. There are other causes like some medications like lithium and things like amiodarone, which is an anti-arrhythmic. Basically, sometimes when you have arrhythmias of the heart, depending on what type of arrhythmia, which is the abnormal heart beating, you may be treated with amiodarone. That drug could cause hyperthyroidism.
General Practitioner Dr. Adrian Kaur. If you believe you have hyperthyroidism, you should see a doctor. You may be referred to an endocrinologist who will plan your treatment. The three main treatment options are medicine, radioactive iodine treatment, and surgery. Now for this week's dose of medicine. Eating foods that have large amounts of iodine, such as kelp or other kinds of seaweed, may cause or worsen hyperthyroidism. Taking iodine supplements can have the same effect. Talk to your doctor about what foods to limit or avoid. That's it for this week's edition, brought to you by Value Drug Pharmacy, Your Health Matters, and Hermosa Health Center, your place for modern health care. 1A Pineapple Place, Ocho Rios. Call us at 974-3370. Being healthy is a journey, so join us again next week for another edition. I'm Maisha Brody. Until next time, be wise and stay healthy.